Hi, today we will be interviewing radiologist Dr. Lynn McCorkle. Could you briefly introduce yourself and describe your path to becoming a radiologist?
Sure. My name is Lynn McCorkle, and I guess I had a circuitous route. I was a physician's assistant first in West Virginia and then went back to medical school. And in medical school, I guess I rotated through radiology and was very interested in it because I liked the pathology part of it, the physiology, the anatomy, and then talking to other physicians. But I also realized that you could have a path where you also spend time with patients. So you got to do a lot of different things. It's always patient-centric, but you also interact with physician within other fields.
Okay. Was there like a specific moment that kind of like sparked your interest in radiology during that time?
No, actually, in all honesty, I was going into ophthalmology and didn't make the match.
Oh.
And I said, oh, well, what am I going to do now? And I realized through that you can be, I always tell my kids that you can be happy or satisfied if you just put your mind to it. And I think for some reason, this is a much better path for me than doing a surgical subspecialty. I'm much happier. So it was really not my choice initially, but when I didn't get ophthalmology, I was, okay, what do I do now? And then I thought about it more seriously.
So did you have to like go back and then train for like the radiology career?
No, what you do is you apply something called the match when you're in medical school. It's your fourth year, and you apply for a match to get into a subspecialty. So ophthalmology is actually earlier and separate from the other one. It was in December. So I knew in December I didn't make it. The other match for all the other specialties is in March.
Oh.
So I had time to go back and say, okay, what am I going to do now? And I had a friend that was in radiology, and he encouraged me to go into radiology.
That's nice.
Yeah.
So what does a typical day look like for you? Or if there's like really no typical day, then what are the different kind of days in your life?
Right. I do breast imaging and nuclear medicine. We all specialize. So when I do breast imaging, a typical day would be reading mammograms. So screening mammograms are women who are asymptomatic. Diagnostic mammograms are women who walk in with a complaint or a symptom, or they've had cancer. Doing biopsies, which I like, because then you're doing a little more interaction with the patient. And also with the diagnostic mammograms, you go in, you talk to the patient, you tell them what the finding is, and then what the follow-up is. The biopsies, you actually perform the biopsy. The radiologist will do the biopsy themselves.
Okay.
So that's enjoyable also because it's hands-on. I get to do something other than just reading films in a dark room.
Yeah.
And I get to interact with the patient. So there'll be a handful, and there are two different kinds of biopsies that we do in mammography. One's with ultrasound, like the sound waves that they use with babies, and the other one's with mammogram. So I'll do both of those biopsies during the day, and then I will also have to call patients back with their results of biopsies because it takes a couple of days. We send them to pathology, and then several days later they come back. So I have to call the patients on the phone and let them know the results. So that's a typical mammogram day.
Okay. For the biopsies, are there other like types of physicians who do that, or is it mostly radiologists who do the biopsies?
Well, it depends on the body part, but radiologists do a lot of biopsy. So they're also called interventional radiologists, and they can do lung biopsies and liver biopsies and kidney biopsies. So they do a lot of that. Endocrinologists may also do thyroid biopsies, but radiology does a lot of the biopsies. Yeah. So it is not. We're not just looking at pictures all day.
I was going to ask you that later. Like, what are some misconceptions people have that you can clear up?
I guess that's one of them, that all you do is sit in a dark room and don't talk to anybody and look at pictures, and it's a lot more interactive than that. I often think of it as being a physician's physician, because a physician will call you and say, I've got this patient, what do you think I do? help me solve this problem. So you're a detective, and then we can say, well, why don't you do this study to help you out with that, and this other study for that, or they'll call you and say, can you do the biopsy? And we'll say, yes, we can. So it's much more interactive. And the other big misconception is that I hear a lot is, oh, you're a radiologist, you don't have to work on call, or you don't have to work late, or you don't work like the other guys. And that's really not true, because 24/7 people walk into the hospital in the emergency room, and somebody needs to read those films. So radiologists will do that. So we work weekends and evenings and all those things, and daytime like other physicians do. So I think that's a misnomer, is that we have a great life and we don't work those hours like everybody else does, but we really do.
Yeah. What are the different specialties within radiology, and did you ever get a chance to explore those different ones?
Yes. When you do a residency, now it's 5 years. Before, when I did it, it was 3, and then I did a fellowship afterwards. But you get to explore all of them. So you could do breast imaging, mammograms, doing the procedures. You can do general radiology when you read a regular x-ray when somebody walks in, or an ultrasound, a CAT scan. You can do neuroradiology, just brain or nervous system imaging, and a lot of that is MRI based. You could do musculoskeletal MRI. I'm a fellowship too, which has to do with a lot of MRI, and you help the orthopods out a lot. So interventional radiology, do a ton of procedures is what they do. If you have somebody who really likes doing imaging but doing procedures and talking to patients, that's a great one too. So there are a lot of subspecialties in radiology.
What made you choose your specialty?
That's a good question. I wanted to be a little more interactive. Instead of just being a general radiologist and sitting in a room and reading films, I wanted to be able to talk with patients, do procedures, things like that. But I do nuclear medicine beside just mammography. So once I finished my fellowship, then I did more time and did nuclear medicine competency just to be able to read nuclear medicine studies. So nuclear medicine are a little bit different. It's when you inject a patient with a radioactive material and then you image them. Depending on where the material goes, you get certain information. You can look for tumors, you can look for fractures. Primarily right now we're using it for cancer, and it's something called a PET CT. So positron emission tomography. That's the nuclear medicine part with a CAT scan. So we do imaging with nuclear medicine and CAT scan. And the idea is that cancer cells we inject them with a sugar base, that cancer cells will eat this. And then we can tell cancer cells from non-cancer cells. I mean, it's not 100%, but it's a great imaging tool for patients.
Oh, wow. Is that a more new kind of tool?
Yep, that's exactly what it is. Yes.
That's cool. Yeah. So throughout your career, what are some of the skills that you've learned that you really find essential in your job now? Or essential in any radiology? Right.
I think being concise and a good communicator. I think that's better for the referring physicians. Because again, I was saying I'm a physician's physician, so they send the patient in for a study, I interpret it, and I have to interpret it so it's clear so they can understand. So I think I've had to learn how to, you can't be wishy-washy, you have to be definitive, but you have to be clear, you have to give a good differential diagnosis, what we say. Say it could be this, for this reason, it could be that for that reason, and then help the clinician out a little bit more so they can figure out what's going on.
What is something that you really like about radiology compared to other healthcare careers?
I like the camaraderie. And what I mean by that is when I am reading by myself, I'm reading a case by myself, but now everything's computer driven. So if I have a question or I want to ask somebody else in my group who has expertise in an area, they can look at this study with me and I can ask them. I think we collaborate. I must collaborate 10 times a day just to look at an image with somebody else. So it's really nice. to be able to do that. Previously, I think you really read by yourself. So it's easy to do with computers now. So I like that. And I like dealing with patients and physicians, both.
When you're like talking about collaborating with people, when you're in the room itself, are you like with others?
If you're in the hospital, there may be 2 other radiologists there, yes. Otherwise, you're generally in the office by yourself, but you pick up the phone, call one of your partners and say, hey, will you look at these images, since everything's computer driven? And they can do that.
Okay.
So it's nice.
What's the most challenging part of your job?
I think telling a patient, one, that they might need a breast biopsy, because I'm concerned about an area. So doing that and doing it in the appropriate way, because everybody reacts differently.
Yeah.
So knowing how to talk to the patient to do that, that's difficult. And calling patients with cancer results, because calling them on the phone instead of talking to them in person, I think that's challenging.
Like, how do you deal with patients who are like worried about what you tell them?
Try to be concise and clear. I usually try to calm them down and tell them it's the truth, but this is a good first step and we'll move forward, and at least they're here right now, so they have the diagnosis, and you usually call them, tell them what the diagnosis is, and recommend that they go see a breast surgeon, and explain that the breast surgeon will then meet with them and explain what the path is from there, but try to calm them down as much as possible.
Okay. And I remember my other question. It was like,
yes,
you tell the other physicians to tell the patients, or are you the ones that are directly telling the patients the news?
We are telling them.
Okay.
So some physicians don't want us to, because they feel it's their patient, but we feel it's our responsibility, since we did the biopsy, and if it's a positive result, we want to make sure that nothing falls through the cracks. So we will call the patient.
Okay.
And make sure they know it's positive or cancer.
So how has AI changed your field, or like new technology? How has it kind of impacted your field?
It's good as an adjunct tool. So we don't use it all the time. For example, we use it with mammography. There's now an AI tool that will circle an area that the AI says, oh, look at that again. So it's helpful. There are a lot of false positives. What I mean by that, it'll circle a clip from previous surgery, and you're like, I don't need to call the patient back for that. So it'll circle things that aren't significant, but it may also circle things that are significant that you may not have seen, or may have overlooked, thought it was normal. So it is helpful.
How do you stay up to date with like the latest changes in your field, especially because it's a field that's rapidly evolving?
Conferences. So we need a certain number of what's called continuing medical education conferences every year. So I keep up on that. And the American College of Radiology has a website. So every day, every morning I get on and you just do a little case review. They're usually from residency programs, so it's great. It's in all areas. It's mammogram in general and MRI. So it takes 20 minutes and you get to look at a case and learn about it every morning. So that's great. That's what I do. It's an easy way to do it.
That's pretty cool, yeah.
Yeah.
What's the most rewarding part of your job?
Maybe when I picked up a small breast cancer, or when I'm able to explain something to a patient so they feel comfortable. We have a lot of conferences too if you're a radiologist, so it'll be with the oncologists, the cancer doctors, the pathologists, so the radiologist will point out things to the other physicians, so just being part of that discussion and working with other physicians. There are a lot of good parts to it.
at those conferences? So there's other physicians, not just radiologists?
Yeah, so with breast imaging, once a week we have a breast conference, and we'll talk about different patients. They're usually anonymous by initial, and the breast surgeon will be there, the oncologist or the cancer surgeon will be there, the radiation oncologist, somebody who gives radiation therapy, the radiologist will be there, and pathologists. So all different types of physicians will be there. We'll talk about patients, we'll go over the imaging, we'll go over the pathology, and then the surgeon will talk about what the plan is, and the oncologist, what they should do for each patient.
It's pretty cool.
Yeah.
What advice would you give to people interested in entering radiology?
I think probably sit with a radiologist.
Okay.
and see if you like it or find it interesting at all. I think, spend some time with a radiologist, because you're right, it's rapidly changing. There's so many different areas you can go into.
Yeah.
It's not the boring, throw up films and look at a wrist film. That's all it is. I mean, there's really a lot to it.
Yeah.
It's exciting. It's great.
Yeah, I feel like I learned a lot more about this field. Like, I didn't really know that radiologists perform biopsies and stuff.
Yeah.
That's really cool. Well, thank you so much for the interview. It was really nice talking to you.
You too, Anu. Thank you.